So basically, I'm Ali, and I'm the Executive Director of Fluid Motion Theatre Company and one of the original founders of the company, along with Lee Johnstone. Lee, would you like to put your thumbs up, please? And Lee is the Artistic Director of the company, and as I said, one of the original founders as well. So what is a fluid conversation? So fluid conversation is basically where we invite anybody to come along to a Zoom meeting once a month and ask us questions about the type of work that we're doing. And this particular one is geared towards a specific project. So Vic, would you like to start recording? I can't see everybody's faces, so I'm not sure what's going on. I'm just going to change
we're recording.
view. There we go. Brilliant. Okay. So the point of the session today, the fluid conversation, as I say, one of the things that Fluid Motion prides itself on is that we're very open and transparent about the work that we do. And I will just do a quick hello from the team. So I'm going to go in no particular order, but it's our people are showing on my screen. So we've got Natalie Watson, who is our project coordinator. Natalie works a lot with our sort of communities and with our school groups. We've got Vic Sheed, who is our digital marketing officer. And I've already introduced you to Lee. And we're also joined today by Christian Flint, do a thumbs, hand wave, yeah, and Sarah Thomas Lane. And they are both actors that are working on a specific project with us. So the project is, it's called a sort of a personalisation project, but it's an NHS initiative run by the Clinical Commissioning Group for North Hampshire. So the sort of framework under which this conversation is going to be around is to do with the NHS England sort of system of appointment systems, etc., with health workers. Okay. And what is the project that we're doing? So we were asked, Sarah's going to have a little bit of a chat on this, but we were asked to create a film about what is the best way for people in the medical profession to be speaking to people that are coming to them for help. So Sarah, do you want to just give us a little overview of what this actual project is?
Yeah, so it started this time last year when we were actually allowed to meet up with people, and we started to chat with various groups about personalisation within the healthcare. So it's about treating the patient as an individual, asking them, well, making sure that they're fully aware of all the knowledge, so the GP or the healthcare professional can pass on their knowledge to the patient, and then the patient is in control. And that's the idea, and everybody in the healthcare system should be practicing that and making sure their patient feels like they're being listened to, they're being heard, and what's happening to their bodies is what they want to happen. Unfortunately, we are finding out that this is being missed. I think, you know, we understand the pressures of the NHS, but sometimes healthcare professionals aren't allowing that to happen, and we want to change that. And it's great that the NHS has asked us to produce something that was going to be foreign theatre. Now it's not. It's now going to be a piece of film. It's going to be filmic, which is actually really good because it means that it can get rolled out and really be shown across the country, maybe, hopefully. So what our question today is, have you ever experienced brilliant personalised care where somebody has really taken the time to listen and allow you to be in control of your healthcare? Or have you experienced really bad examples where that hasn't happened? And we just want to know your stories, because we want, when we present our film piece, we want it to be as real as possible so that everybody can identify with it. So please, we want to hear your stories. So please do share. Thank you.
Lovely. Thank you, Sarah. So that's the gist of what today is, and in order to be able to make this film as meaningful as possible, we need input from the service users of the NHS. So if anyone would like to kick off, I know certainly George, you mentioned that you might have to leave early, so if you feel comfortable, would you like to start the ball rolling? Oh, we can't hear you, George, you're still muted.
There you go. Sorry. The fun of joyous Zoom calls.
Yeah, so I've had a lot of experience with the NHS because I've got a long-term disease. So I've got MS. So just a bit of background, I was diagnosed back in 2003, didn't really have any symptoms and kind of forgot about it for about 13 years. I then had booked to go and see a consultant because I'd got remarried, and me and my husband wanted to see whether having a baby would have any impact on my MS. So I booked to see a neurologist, and we went to the appointment, and it wasn't the neurologist I was meant to see, it was a locum. So I walk in after 13 years of not speaking to anyone about my MS really. And this locum guy is a newly qualified consultant. And we walk through the door, and the first thing he says to me is, "You're walking funny. You've got an MS gait." I'm like, okay. So kind of that's not why we'd gone there. So I hadn't even thought about my walking. It wasn't really an issue to me. I hadn't realized I was walking funny. And that's not an issue so much him saying that, but we'd literally been in there for a few minutes, and he turned around after asking a couple of questions and said, "I think you've got progressive MS." And I was like, what? You know, that kind of wheelchairs in my head. You know, I know progressive MS doesn't really have a cure, and I hadn't really spoken about MS for 13 years. So it was kind of like mind-blowing. I was just like in shock. But he hadn't even looked at my notes. We hadn't had any real discussion. It just kind of went straight to that. And that had a massive impact on me because, you know, he hadn't done an MRI at that point. He didn't have any kind of evidence. This was just, I guess, his opinion. And it really threw me, and that's all I could think about. You know, my walking went downhill drastically after that. I mean, Ali knows, she knows, we've known each other for a long time, and it really impacted me from that moment onwards. Now, that could be coincidental. Maybe my walking would have gone downhill that quickly, but if you know anything about MS, it's really associated heavily with stress and mindset. And so I think that was really negative for me. He arranged for me to see an MS nurse and to have an MRI. And so that didn't happen for a couple of months later. When I saw the MS nurse and I told her what happened, she said he should never have said that to you. In those circumstances, having seen me for such a brief period of time, he shouldn't have made that judgment call. I had the MRI. I then was meant to go and see the actual consultant that I was meant to see originally in October. It got delayed because she was off sick, so I didn't see her. It got pushed back to January. All this time, I had no result. Well, I had a letter about my MRI in, I think it was maybe the end of August, September time, but it didn't mean anything to me. I'm not a doctor. I didn't understand what it said. So I hadn't spoken to anyone. I had this letter, I had the MRI, but I had no further follow-up conversation with a consultant. So January came, it got pushed back to February, the end of February. So by the time I saw the actual consultant, it was the end of Feb. So, you know, I'd gone to see him in April the year before. So that was a long time between the two appointments, being told that I had this progressive MS. She looked at my MRI and said, "I don't think you've got progressive MS, but we can give you some treatment to kind of stop it progressing. It may or may not work, but we'll do that." So then I had some treatment in the following April, almost the year from when I saw this locum guy. And then in the August of 2000, and I think it was 2016, she did another MRI and then sent me a letter, and in black and white she put, "It's not progressive." And at that point it was like I'd had 18 months of thinking I had progressive MS, even though she said she didn't think it was, she wasn't sure. It took 18 months to have it in a letter. You know, but during that whole period, my walking had gone downhill drastically. My mental health wasn't great when it came to the MS side of things, because it was always in my mind constantly. Since then, loads has changed, and I'm much more aware of things now because I've joined groups and I know a lot more about MS. And it may well be I have progressive, I've had different consultants tell me one thing and another over the last couple of years, because my consultants have changed. I've been moved from Basingstoke to Southampton, from Southampton I've gone to Froomley. Every consultant tells you a different thing, has a different opinion. And if you speak to most people in the MS community, they don't trust consultants. They don't trust that they're on your side. They just think that they want to give you drugs, and your appointment's 15, 20 minutes long if you're lucky, and it's on to the next one. And it feels like they don't really have time for you, not on a personal one-to-one basis like a doctor might have.
George,
yeah.
do you feel, I don't want to put words in your mouth, but do you feel, fobbed off is one thing, as if the consultation was really quick, but I suppose a bigger question is, do you think being given that initial diagnosis without any pre-warning, no preambling or anything, actually made your MS temporarily worse as a result?
Definitely. And from what I've learned now, I keep my stress levels now to a bare minimum.
Yeah.
And I focus on diet and exercise and all the things that neurologists won't really focus on, but actually I find are way more beneficial than any advice they've ever given me, really. I just, now when I get an appointment once a year for my consultant, I almost go because I have to, but I dread it. I don't see it has any positive impact in my life going to see them. And most people I speak to in the MS world feel the same way. MS is really complicated because everyone gets impacted differently. There's so many variables. So it is really hard. It's not like cancer where it's a set path. But yeah, I do think that when it comes to a long-term condition like MS, that maybe they need to, I don't know. It's hard. There must be so many patients and so little time. I don't know what they do. But I do think that they should ensure that newly trained doctors, consultants, don't just turn around and give someone a diagnosis of what they think in their opinion within 5 minutes of meeting you.
Thank you, George. That's really insightful, and thank you for sharing that. I know how important it is to you. You're quite a campaigner for MS, so I know how important it is for you to share things like that. Thank you. Does anyone have anything that they'd like to comment on what George just said, or talk about? So yeah, Dowie?
I was sort of listening to Georgia speak and sort of nodding along this, because it's surprising how similar her experience is to my experience as someone with bipolar disorder, even though MS and bipolar are almost opposite ends of a spectrum. Everything from locum doctors not reading notes to giving an instant diagnosis without actually knowing the person, to completely disagreeing with diagnoses, to one consultant telling you one thing and somebody else telling you another thing, and then the nurse telling you something different. It's a real surprise how similar the experiences are.
Yeah.
Or maybe it's not surprising. Maybe this is a common theme with long-term illnesses and disability, that we all have similar experiences just from our own subjective places.
And quite scary, the words that come out of somebody's mouth in literally a 2 second or in a minute's time frame, the impact that can actually have upon your feelings of self-worth and physical feelings and emotional feelings that raises, isn't it? It's quite scary.
Yeah, definitely.
Yeah.
I'll jump in quickly. I said I wasn't going to talk much today, but I'm going to. What we found, because this is the fifth of four. This is the last fifth focus group we've had with people. I don't know if Sarah and Christian will agree, but we found that it's that first impression is quite important, isn't it? That first moment with a healthcare professional is make or break, actually, and especially when we conducted the focus groups with people that were in the mental health service users at the Wellbeing Centre. One bad phone call and that just puts them off for life. It can make them completely shy away from ever consulting a doctor ever again, just from a bad conversation or a sort of bad experience of the first time that they've come into contact. So I think that's actually something that's really important to say and to keep thinking about, is that what is that first impression, and we've heard that a lot in the focus group, so I just thought I'd share that.
Dowie.
Yeah, I was going to say, I've actually got my psych notes under a data protection GDPR request, and it's surprising how often the term presents well comes up. And that sort of idea of a first impression, I think, swings both ways, especially in psychiatric or mental illness. Because if you present well, if you look like you're coping, your whole world can be falling apart, but you will get less of a diagnosis than if you were messy, in pajamas. And I find that completely shocking, because anyone who's ever worked in the theatre knows that there's a costume, and whenever I present to a doctor, I am wearing a costume. I am wearing nice clothes, so I can sit happily in a waiting room, not feeling like a twat. Sorry for the bad language. But it's a costume, and that first impression swings both ways. Because I presented well, I'm diagnosed with cyclothymia, when everyone who has seen me have an episode, including a consultant psychiatrist who's now left the NHS, has gone, "You're quite clearly bipolar 2. What the bloody hell's going on?" So I think it swings both ways as well.
Yeah, I'd definitely agree with that, actually. And having just done, because I'm doing some research at the moment on mental illnesses in contemporary performance, and actually that's exactly, apparently there's a whole page put to the fact that psychiatrists basically diagnose you through the clues that you present to them in that consultation, whether that be through what you're wearing or the way you talk or the way you communicate. And I think that must happen when we go along to a consultation with somebody, whether it be a nurse or a doctor, a physiotherapist. The way that initial first impression impacts us, it also determines how much we then disclose to that person. Because if they give us a negative vibe instantly, we're perhaps not going to tell them what we actually came for, because we might feel we're wasting their time. Oh, they've already made up their mind. What's wrong with me? So I think it does have, the way that you are initially, that those first 30 seconds to a minute probably determine whether or not your consultation is going to be successful. And that might be a bit generalizing, but I would imagine it must have an impact. Would anybody else like to share anything?
I have. So I got a kind of the start of a diagnosis, but completely out of the blue. I got a voice message, which I listened to when I was on the train, to say that I would potentially have problems conceiving.
Oh.
I had not been to the doctor with this area in mind. I had been to the doctor and got a locum, and she just said, across the board, you've never had blood tests, so let's just do it just as best practice, see what it throws up, because you've never had them, you're an adult. And then like 2 weeks later, I got a voicemail from a different doctor from the same surgery saying, Ms. Sheed, it will be a challenging path, blah, 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 if you're planning to conceive, blah, blah, blah. And it was just one of those out of the blue, proper, like the landscape of your life. It sounds so dramatic, but it kind of was. But I was doing such a mundane thing. I was in between Waterloo and Clapham, and I'm like, what? I didn't go in with that. It's always just like skin and asthma. That's all I ever go to the doctor for. And then suddenly I am challenged in the reproductive area. It was bonkers.
Yeah, Sarah?
On a similar note, I've had a few friends go for, like, if they've got Bupa or something as part of their work, like thing that you extra bit, and they've gone for like tests and blood tests and stuff. And I think Bupa as well, I think they quite like it. If you're over 35, that's it. You're going to have a problem. And it just seems like that and two friends have had a similar thing. They haven't been in between Clapham and Waterloo, lucky for them, but they have had that experience, and then they're like, shit, what's going to go on? And then they've gone on at 41 and conceived no problem. So there's something going on there.
Yeah, absolutely. I mean, that again, that's another life-changing diagnosis given in a space of seconds. Lee.
And I think it's a bigger thing around, you know, algorithm. We're seeing that with the vaccine, aren't we? Algorithms and people being told they can have the vaccine when they're not actually in the category yet. And I think it's just this big data, non-personalized sort of just methodology and approach that it doesn't work, because it lumps us all in as specific I don't think there's a sort of a whole holistic, wide view of individual healthcare, and I think it's to do with the big data-driven beast that the NHS is as well. Obviously, there's a way in which that is useful and important, but I think, oh, you know, Vic's there. She's going to send her that message just there. We haven't spoken to her about it at all ever before in the past, but we'll just send her that because she's on the list. That's really interesting, isn't it? And that's I think that's about being this huge thing that is real, that people try and sort of break and get into and change, but there is this constant sort of wall, I think, that we're all having to fight.
Yeah, George?
Interesting on the vaccine, because one of my consultants once told me that I shouldn't have the flu jab or any vaccines, because when you've got an autoimmune system disease, it can trigger relapses. And if she had MS, she wouldn't have them. So from that point onwards, I didn't have the flu jab and I don't have it anymore. With the vaccine, obviously I'm like thinking, well, should I have it? Should I not have it? Based on what she told me, I don't think I should have it. You know, I have enough to deal with day to day. I don't want to make my day to day worse by putting something into my body that potentially could give me a relapse and make me worse. I know getting COVID could be horrible, but again, there's no guarantee that I would catch it or I would get it badly. So it's kind of a real catch-22. The neurologists, and when I spoke to my new neurology team in Frimley, have said, well, the board of neurologists have decided that the risk of COVID is greater than the risk of having a vaccine. So it's like, oh, well, so I won't get a medical exemption. So I either take it or I don't take it, and then I may not be able to travel or do things. So I'm put into that real, it's like they don't understand how much of an issue that is to me, because I've been told not to have vaccines by one consultant, and now I'm being told by another consultant that I should have a vaccine because the risk of COVID is greater. But what about my day-to-day life? That's a big risk to me. It's a very tricky one.
Yeah, so basically what's happening there, George, is mixed messages, isn't it, from different consultants? And because they are the professionals, it's sort of who do we believe? What do we do? Lee, you looked like you were desperate to come in there with something. No?
About that notion of word professional. You are in charge of your own healthcare, aren't you? You are the person that knows the most about you. There's an interesting discussion there around professional. And I think that's where a lot of people are scared of suggesting anything else to a medical professional because they don't know enough. Whereas really, you are the one that knows the most about how you're feeling and thinking. Yeah, that'll be the last time I probably will talk, because I said I wasn't going to talk too much.
Dowie.
It's funny Lee's brought that point up, because I was thinking the same thing. But for me, what was really interesting is talking to a counsellor a few years ago. She was amazing. She was the best counsellor I've ever come across. Because she identified that, one, I'm very highly intelligent, I needed one-to-one care, and she gave me as much as I wanted. So I actually ended up maxing out the allocation that I could have under the NHS. But she was very much a thing of, look, I'm a counsellor, but you are quite clearly the expert on your life and your condition. Like, feel free to disagree with me. And a while back I went to see my GP just about coming off my meds. And I explained to the GP my reasons for it, talked her through sort of my awareness of sort of the pros and cons. And she just turned around and said, look, you are the expert on this condition. Like, I've come across this a lot, that people who have these long-term conditions are the experts. I'm not going to suggest anything. I'm just going to refer you straight away. You can speak to the consultant and then see what they say. And that was brilliant, because rather than going, oh, well, this is the official line that we have to go down, I'm just going to fast track you. And that is an amazing example of personalised care, because she recognised that actually, yeah, I just knew more than she did, you know. And I think that's partially because of the stuff that I do as an artist and as a researcher. But I'm also very aware of people who've got long-term conditions, who aren't doing research, who aren't doing performances, who are just experts in their own condition and have had to fight with medical professionals to get what they know they want. So another example would be my dad. My dad was given loads of medication when he left the army for back PTSD. A civilian doctor took him off of it. My dad's back went. He was referred to a consultant. The consultant went, why didn't you just keep taking the medication that you wanted to take? And my dad was like, well, I couldn't get it because the pharmacy wouldn't give it to me because of the GP. And my dad literally now will not come off of those drugs. He argues every single time they try and change his medication. He goes, no, because you've changed it once and I was out of work for a year because I couldn't move.
Mm. Yeah, that's interesting, isn't it? Who's the expert? And undoubtedly we must, you know, to a certain extent, I think it possibly different conditions, maybe we become experts, or different people become an expert dependent on the condition, if that makes sense. So if you get things like common colds, I suppose it could be argued that the GP probably knows the best way to treat us. But more intense conditions, sort of mental health conditions and stuff like yourself, George, with MS, you become the expert because you're the one dealing with it on a daily basis. And they're only talking to you for a 10-minute, if you're lucky, consultation.
Can I say something?
Yeah.
It's interesting because Ali knows I do a lot of neuroplasticity exercising to improve my mobility, and not once over the years of me seeing consultants has anyone ever spoken to me about exercise and in that way. They've always been like, here's the drugs, have the drugs. I don't want the drugs. And I look now and what I've learned from professional people that I follow online in terms of neuroplasticity and movement. There's an amazing guy called Trevor Wicken who runs an MS gym online. And I've learned so much from him that I've never learned from a consultant. I mean, amazing stuff like how my walking went downhill in the first place, how it starts with spasticity in my back and so forth. And it's a long story, so I'm not going to go into that. But, you know, I look back and I see people with MS who are in wheelchairs and permanently, and I feel sad for them that they were never told, actually, they could have avoided that if they had been given advice on movement and diet and, you know, that you can change your brain pathways, you can improve things. And I think it's only a few weeks ago, someone in the group shared that finally, it looks like the MS Society is starting to realise that neuroplasticity can change things. And hopefully consultants will catch up with that. But there's a lot of consultants who still don't see that that is a way forward for people with MS. And actually maybe giving drugs is not the right thing. You know, a lot of people get muscle relaxing drugs, but that's not really necessarily helpful, because you want to build strength in your body and you want to be able to move and you want to be able to do things. So yeah, I think consultants seem really far behind actually what a lot of people who do research and look into their MS and speak to other people with MS seem to know a lot more than the consultants seem to know, which isn't how it should be.
Dowie?
I was just going to say, having been a medical student for a very brief period of time doing my MSc, the one thing that I became acutely aware of is that medicine is really slow to change, because it's a naturally risk-averse culture. It's non-entrepreneurial, although I hate that term. And funding is so strict that the minute you deviate from any sort of established norms, it's really difficult to get funding. And that's why things like mindfulness were so slow to come in. It's why alternative forms of therapy were so slow to come in. It's just because it's a mammoth beast and they just can't change quick enough. And it's a cultural thing, you know. And really, we need people to speak up more, and it to come from a government level for people to be more, not necessarily risk taking with people's lives, but sort of going, oh, there's this new bit of research, let's have a look at this. And I think a really clear area of where medicine is really risk averse is cannabinoid treatments, where in other countries they're using cannabis very effectively to treat things like arthritis, but in this country we just go, no, it's a drug, we can't touch it.
Can I just, before we sort of move on a moment, just to say that if anybody wants to say anything but doesn't feel comfortable speaking out, by all means, please put something in the chat group and I will happily read that out for you. You know, if you want to partake, but as I say, don't, because we're quite vocal group, please don't feel put off. Happily put your thoughts in the chat and we will read those out. So does anybody has got anything to say at the moment, or shall I kick in with another slightly different train of thought? So I'd like to talk about the receptionist at the desk at the doctor's, because I think the receptionist can be, and the receptionist is part of the NHS. They are an NHS worker, and I think they can hugely influence your experiences with your local surgery or the hospital appointments or whatever. And a prime example was my daughter yesterday, who phoned me in tears because she had a scan, which was quite an important scan, supposed to be taking place. It was the second rebooking of it. It had to be cancelled because unfortunately, excuse me, she worked with somebody who had COVID, so she had to isolate, cancel the appointment. So this appointment had been pressing on her mind all day. She was quite anxious. She's a school teacher, so couldn't come out of lessons to phone up and find out exactly where the appointment was, and assumed it was in the same location as a previous scan that she had done. Now, we're not sure whose fault it was, but for some reason it was at a different location, but she hadn't received any text messages about it and she hadn't received a letter, so she had no idea. So she turned up at the wrong place. When she phoned the right place, the response was really quite hideous, and she actually ended up crying for more than an hour because they made it sound like it was entirely her fault that she hadn't received the text messages, her fault that she didn't know what the right location was, her fault that she'd missed the appointment. And it just made her feel so worthless. And after having built herself up all day for this appointment that she didn't really want to know what the results are going to be, and now has to wait another 2 weeks before she can get that answer. So it's going to have been from the start to finish 3 months before she actually gets this scan. And I just think that the way the receptionist can talk to us sometimes can make or break our responses, because we've all had equally, I've had some very positive receptionists who have been uber helpful and have really been lovely. So I'm just wondering if anyone's got any similar sort of stories that they might want to share about that and what worked and what didn't work, maybe.
I think I've been very lucky. I struggle with depression, and to begin with, every time I went to the doctors, I saw a different doctor. Mm-hmm. And I was calling up to the practice and to see whether I could see another doctor or to see a doctor. And I got told I couldn't see the same doctors I'd seen before because she'd left the practice. And at this point, I was so overwhelmed. I'd never been depressed before. I didn't know what was going on. I was just in tears on the phone. And this lovely receptionist, she did her best and sort of explained things to me, but she put me through to a different doctor, and the doctor called me back. She said, the doctor on call. And then this doctor said, all right, from now on, you can just see me. And that made such a difference. And I'm still seeing her now, because I know it's a bit on what we were talking about before, but you know, that somebody being able to see the whole scope of your treatment, how you were at the beginning, you know, that you don't have to come in and if you say you're feeling a bit better, oh, right, you must be well, then off you go, you know, because I've not seen you before. And then that kind of thing. I think I've been very lucky with the receptionist who did that for me.
That's really good. Thank you for sharing that, Abigail. Yeah, so there clearly is you know, that's a really important step towards us getting the right treatment, isn't it? Or the right support and help.
Yeah.
And yeah, thank you for that. Anybody? Yeah, Vic?
I mean, this is vaguely comical looking back on it, but I went to the surgery and the receptionist kind of leant forward. It must have been something about how my body language, because she leant forward as though she knew it was something sensitive. She was like, what's it about? And I was in such pain that I just had no kind of energy or strength behind my voice, and everything, my whole body was just in on itself trying to deal with the pain. I was like, oh God, it's cystitis. And I whispered it across, and she went, what? And I was, it's cystitis. And she kind of was a little bit surprised, and she was like, okay, go up to that waiting room, blah, blah, blah. Didn't tell me, and this is for anyone who's suffered from this, she didn't tell me, don't go to the loo before you see the doctor, because that's the first thing the doctor will want is a urine sample. I have no control. I mean, so much time in excruciating pain in various toilet cubicles for like a week. And so of course I went to the loo whilst I was waiting for the doctor, because that's just the persistent excruciating need. And then I went in to see the doctor, and she was like, oh, if you could just do me a urine sample. And I burst into tears and I swore at her. I was like, Earth, are you actually kidding me? This is like a vital little nugget of information I really could have done with in between the receptionist, who specifically asked me what was going on, and then coming to you. I was beside myself. Yeah, just, I mean, a one-off, but horrific at the time.
Yeah, and you've sold it to us as quite a funny story, but actually it's quite serious, isn't it? Because yeah, it's that lack of communication and lack of training, perhaps, with the staff on the end there. And I don't want to knock the NHS, because we all know that they are working so hard and they are so strapped for money, and a big part of the flaws are cash strap. You know, it's cash, isn't it? We all know that. But I think there's some little things here coming out that could quite easily reverse some quite hideous situations. So, anyone want to add to that?
Trying to think, I waited once for an appointment, but I can't remember what it was. I've got memory like a sieve. But you know, the consultant was clearly late. She travelled from somewhere else, so was late. So they knew that before I came to the appointment. And yeah, you know, you end up sitting there for like, I think I was there for an hour and a half, 2 hours waiting for this doctor. And sometimes, and we've had that a lot at the hospital, my husband as well, with appointments. And again, it comes down to lack of funding and technology, but they can text you to tell you that when your appointment is. If they could have a system that could text you to say, you know, your doctor's going to be 2 hours late, is running 2 hours behind, or whatever, you know, that can make a positive impact on your day. You know, if you've got work or you've got other things going on and you knew that, then you can plan for it. I'm not sure how viable it is, but I do find that sometimes people, you know, we get stressed because we're sat there waiting and waiting and waiting, and we've got other things going on. The doctors are stressed, or the consultants are stressed because they've, you know, they're behind schedule, they've got angry patients, and it all kind of works against each other. And if there was a better system for communicating when there were delays, because they put them up on the notice board in hospitals sometimes, you know, this doctor's running an hour behind schedule, you know, a quick text message to those patients for that morning to let them know it's going to be later could maybe ease it for everyone in the system. I don't know, maybe that's just wishful thinking, but something that would potentially help people.
Absolutely. We've had another question from the group. which is, how do people feel about the automatic check-ins that some GPs have? So my surgery in London has one, and it feels very impersonal. What do we think about those?
I quite like it, actually.
Yeah, I'm always quite aware of the fact that I've got your personal information on quite a big screen. That always strikes me. You know, my date of birth flashes up on the screen, and my full name flashes up. And I don't have an issue with that, but I can imagine for some people that might feel a little bit.
I think I'm quite like Abigail in the sense of I haven't had a good experience with many, if any, NHS receptionists. So I would rather not just tap away and not. But the problem I do have is not knowing where the hell to go, because if you're not a regular in these places and you go and there's like 4 stories, and then they're going to bark at you because you're in the wrong bloody place and nobody told me where to go. So I do have an issue with how these places are run, but generally the least I have to do with people when I'm in a situation like that, I think the better.
For me, it feels very much like being in Argos, because it's my question. In my surgery, you do all the things on the login, and then it goes, Mr. Evans to doctor, and it does have that sort of order number 3 to your collection point, please. You know, feel about it.
I think. Go on, Sarah.
Sorry, really quickly, that's another thing that we have spoken to people about, is that all of a sudden you're told to go to number 3, and it's not in normal order. Like 3 might be over there, and again you don't know where the hell you're going. And this has happened to me, like in my one in London and my now one in Basingstoke. So if you have depression or something like that and you can't find it, you might just walk out and not go to that appointment, and I think that's something that we have talked about exploring as well.
They should. I think for me, the automatic check-in should be. I should want to go and talk to the receptionist, but I don't want to. So the automatic check-ins for me are great, actually. I always feel. I mean, again, it's my personal experience and not reflective necessarily of the work we're doing. Anyway, but I feel like the receptionists I've come into contact with have everything else to do but talk to me. That's what it feels like. There's always a doctor wants something, there's a phone ringing. I feel like I'm interrupting, and I hate that. I feel like I'm like, do I say something now? So automatic check-ins for me, love them.
And that's interesting in itself, because if you feel alienated the minute you walk in, the situation's only going to go further downhill, isn't it? Okay.
There's some work being done. I'm interested in what people think about this. There's some work being done in North Hampshire, actually, around creating creative waiting rooms. But the idea of changing what the concept of a waiting room is. It's less about you sitting in silence and waiting, looking at flyers of cancer and everything else and all the bad things that could go wrong, but making them really relaxed, chill out spaces. That's something that's happening quite a lot of at the moment. I just wondered what people thought of that. Do waiting rooms need to be changed? Do the spaces need to physically be changed in terms of the environment?
I would say from experience, I've been to an MRI before where it's been a private, so it's run by a private company, and you go in and instead of, like you say, your hard back plastic chairs, there's nice comfy sofas and there's a coffee machine in the corner. Now 9 times out of 10 you don't have a coffee, you don't have a glass of water even, but the fact that it's there instantly makes you feel a bit more relaxed and more comfortable. So I would say absolutely, and especially if you're going for something that you're really nervous about or a bit, scared of knowing the answer to or something, then I would say absolutely that's a really positive thing.
I agree. I fortunately don't go to the doctors often, but because I don't, they feel like a really alien place to me. I don't know where I'm going. I don't know where to sit. I don't know where the doctors are. I don't know where the check-in point is. And that's, is fine to a certain extent, but you are right, Annie, making that environment a bit more inviting. And it's in the waiting room can feel like a very tense place because of what you were saying earlier. You're waiting for your number to be called and to go in, and so there's that anxiousness already. And if you're not, and even if you're going in for something, you know, quite minor, that's not necessarily an anxious thing, I think it heightens it. So to be able to feel like you belong in that space, regardless of if you go in once a year or every day, I think there is something to be said about creating a really inviting atmosphere or experience in the waiting room.
Absolutely.
And that.
Oh, you're on mute, George, if you spoke to us.
Am I?
Yeah, that's it now. Yeah.
My doctor's surgery, all the seats are facing one way, and you're meant to look up at a sign that has your room number, so they don't even announce it. So you have to sit there like this the whole time, which is just odd. You know, no one wants to sit like that. I don't know why they don't announce it. And when you queue to see a receptionist, the queue can sometimes be really long, but there's no seats in the queuing bit. So if you're disabled like me, that's, you know, and they get a lot of older people in there as well.
Yeah, that's very true.
You know, this doesn't. And when I asked them about that once, they just kind of looked at me like I was stupid. You know, why do we need a chair there? You know, but just there doesn't seem to be any consideration for people's needs in the waiting area. They also make you, if you're coming for a blood test, you wait in the main area, and then you have to walk all the way around to the blood area where there are seats. So why can't you just go and sit around there rather than having to walk further one way and then walk another whole section, especially if you are disabled? That's kind of hard work, you know. So little things, I think I guess they don't have time, but they don't think about the little things necessarily that would make life easier for people.
Absolutely. Anybody else? I'm conscious that we've only got 10 minutes now. So has anybody else got anything they'd like to bring up?
I was just thinking on the point that you were raising just then, was that the practice I go to has two different sites, and one site is very Argos with the you know, go and fuel collection point thing, but the other one's really small. So their waiting area is very tiny. And the doctor actually opens the door herself and calls you into her surgery, and the difference is really lovely. It makes a big difference, just that sense of, oh hi, you know, not oh god it's you again, but you know, hello, welcome, come on in, that kind of thing, rather than the impersonality of the sign.
Yeah, no, that's a very valid point, actually. I was thinking then about experiences myself when I used to take my father to the doctors, and how, again, we were always greeted by his doctor, and she that instantly, and that rapport, she always said hello. She always remembered who I was, and I know we were there regularly, so obviously that will happen. You build a better relationship with your GP, but she always said, "How are you?" Which was really nice. How are you? Before she asked about how Dad was, because she knew I was Dad's carer, it was how are you? And that really it made a big impact. George, you're just leaving us, but thank you very much. Thank you for taking part. Thanks. So, any other points anybody would like to raise? Apologies for my dog in the background. I've got one other thing I'd like to say, which I'm not sure how relevant this is, but this is to do with the gap between when a GP or a nurse has sent you for a referral to something, and then you're waiting to move on to the next stage. And this is an experience my other daughter had, where she has been waiting, and she asked me to share this. She's been waiting for a psych referral. And she's been diagnosed by a psychiatric nurse as having bipolar 2, ADHD, and PTSD. And she went to a new GP. She's a musician and she travels around a lot. So trying to get in with the doctor's appointment has always been difficult for her. And she eventually did, and she's spoken to them. And he said, well, we need to refer you on, obviously, to a service to get you formally diagnosed for the ADHD, because then we can work out what levels of medication and things you may or may not need. And she got the referral, and she got a letter back from the referral basically saying, if she was copied in, it was a copy to the GP, but basically saying, we don't do referral, we don't do ADHD here. And the door was closed. It's like, you've waited 2 years nearly to be told, you know, because of the different doctors she's been under, to be told that they don't do it. So now what? And she had to go back to the GP again to sort of chase them up and say, well, have you seen this letter? What are you doing about it? Because I still need the referral. So she sort of just fell into this no man's land. And if it hadn't have been for the fact that she's quite a forward thinking person, and obviously I was there to encourage her as well, I can imagine if somebody got that on their own, who was really introverted or feeling very unsure about their mental health and how they were dealing with it and was scared of it, they might well just throw that letter in the bin and say, okay, they don't do it. And that would have been the end of it. And that really, really worried me, actually, really worries me, that she could have got lost in the system had it not been for the fact that she and I are both quite tenacious and sort of refused to give up the fight. So I'm just wondering if people have any sort of similar experiences of things like that, or anything to comment on that.
I was waiting for a referral for therapy after my diagnosis with depression, and I was told that if I wanted to speak in a group situation, which I find very difficult, I could see somebody within the next 3 weeks. And if I wanted to wait for one-to-one care, I would be reassessed 3 months' time, and they would see about putting me on the list. And I just thought that I wasn't sure how I was going to get through each day at that point, and I didn't know what to do. And if it hadn't been for my manager at work, who said, look, the grade you are, you should be able to get private healthcare, and he just sorted it all out for me. If it hadn't been for that, I don't know what would have happened to me. And I understand that there's definitely difficulties in funding in mental health and all of that. And I don't want to bash that side of it, but just being told by a letter, this is how long it's going to be, was just, it was devastating.
I can imagine, and it's so hard, isn't it? Because especially with well, I won't say just mental health, because obviously with any illness, you've often spent quite some time plucking up the courage to seek help anyway. And if you don't feel then supported by it, especially if you've been sitting there going, well, I've had this pain, or I've had this problem, and it's been going on for months and months and months, maybe I should get it checked, but am I wasting people's time? And then you get sort of dropped off the radar. It's not helpful, is that, at all?
No.
One of the things that we found, Sarah, Christian and I, after doing these focus groups, is some focus groups were set up from the NHS and were specifically targeting people with long-term health conditions, or people that were doctors' participatory groups who were very much aware of what they needed in terms of the healthcare system. They were very much geared to knowing what to ask the doctor and when to ask it. However, what we're interested in as well is those people who aren't comfortable in pestering or always ringing or finding out where the letter is, or because not everyone has that capability or ability, or isn't in that right headspace, then it's how does the health service help and support those people? It's all very well saying making people in charge of their own healthcare, and lots of people have said, make sure you've got a list of what you want to talk about to the GP, but some people might not have the energy to face that, to face doing that. So we're really interested in how the healthcare service can address that group of people, the people that really feel like they can't speak up and sort of be in charge of their healthcare in the way that the NHS is saying everyone should. So that's a really interesting point for us.
Absolutely. So does anybody have any final thoughts? Maybe Sarah or Christian, is there anything that you'd like to, has anybody not said, or that you'd like like to add anything?
I don't have anything. I think Christian's about to speak. See?
Yep.
Yeah, I'm just trying to unmute myself, but I'm struggling with the technology as usual. Here's another thing that's been preoccupying me, and forgive me if it's a little poetic, but since COVID, I've been aware of not only myself, but my extended family and friends being acutely aware of a cloud of mortality. And I'm kind of interested, listening to this whole conversation is, it's fascinating, because it's like we're in a black comedy where we all have a heightened emotional vulnerability, and everything around us is advertising our mortality. I mean, and it's endless with the news, how we're led down a road of incredible statistics. And I wouldn't be surprised if this tsunami of big data it is overwhelming on our mental health. It's perhaps not. it's a question, a philosophical quandary, rather than anything practical we might be able to apply. But listening to this conversation, I can't help feeling that I spent 45, 50 years running around like a happy-go-lucky puppy, and I've suddenly run into a cartoon anvil.
Apologies, there's someone at my door, so the dog's going to bark. Lee, can you take a second?
There was something interesting that, Christian. There was something. Natalie and I have done some work with some health professionals, with young people actually recently, and some GPs, some paediatric specialists. And she was saying to me, you know, she has people come in to her surgery and you know, really anxious about COVID and what's happening, and not necessarily don't have COVID, but you know, anxious about all the stuff that's going on, you know, the environment that it's causing. And she says we're living in a world where daily death stats flash up on our screens, and the impact of that is incredible. We've never really had that, apart from times of war potentially, but not in this digital age, social media age, where just death stats constantly, and it then sort of normalizes it, and you think, oh, I'm used to seeing 100,000 people have died, and it's like, whoa, and there is something there as well in this strange world we're living in, where there's this sense of just sort of gloom, isn't there, and sort of just a weird time, I think. And I think, you know, the GP said that she had someone come in and said, my son is literally, what can you do for him? I think she said, what can you do for him? And she said, well, I can't. I'm sorry. And she actually said, I can't. You know, I think he was saying, I think she was like, he's just so anxious about the situation, and the fact that he's seeing these death stats every day. What can you do for him? Apparently, she's getting loads and loads of those calls and requests and appointments. And there's something that's got to be done there as well, because I don't know what the answer is, but I just thought it'd be useful off the back of what you said, Christian. I think it's really interesting.
So we've slightly overrun, or just coming up to our hour, and it's been absolutely fantastic. And I'd like to first of all thank everybody for contributing and taking part, and that's great. Thank you very, very, very much. We've got our next fluid conversation is taking place on the 25th of March. We haven't set a theme in stone yet. We've got a few ideas, but if anybody has an idea of something that they would like us to talk about at the next fluid conversation, please feel free to either pop it in the chat or to email us at some point. That would be great. And it's just for me to say a very big thank you and a little wave and a wave from the team. Thank you, everyone. So thanks for taking part. Take care.